I'm Dr. Mark Hatala, and I want to welcome you to the 16th and final chapter of the Openstax Psychology textbook. Today we'll be discussing therapy and treatment, and so we'll talk about mental health treatment, types of treatment, and different modalities. But let's get started by talking about the fact that 19% of U.S. adults experienced mental illness in 2012, and the rate was similar in teens. About 13.5% of those adults received mental health treatment. There are differences in treatment rates depending on the disorder. So in children, anxiety disorders were the least likely to receive treatment, and ADHD and conduct disorder were the most likely to receive treatment. Well, what were things like in the past? For centuries, people with mental disorders were treated very poorly. They were believed to either be possessed by demons, or have it be witchcraft, or that it was the curse of an angry god. And exorcism or trifling were common treatments for mental illness. Asylums were the first institutions created for the specific purpose of housing people with psychological disorders. The focus was not on treatment, but on ostracizing them from societies. By the late 1700s, Philippe Pinel argued for a more humane treatment for the mentally ill. And in the 19th century, Dorothea Dix led mental health care reforms in the United States. And even then, though, asylums were typically filthy, they offered little treatment, and they kept people for decades. By the 1960s, antipsychotic medications were introduced, and that led to deinstitutionalization, or the closing of large asylums. The idea was that people could stay in their communities and be treated locally. And so today, large community health centers are open across the nation. Now, people who are homeless and people who are in jail suffer mental illness at even higher rates. So 26% of those living in shelters experience mental illness. Psychiatric hospitals are very expensive, $800 to $1,000 a night, and people are usually hospitalized only if they're a danger to themselves or others. And we can talk about involuntary and voluntary treatment. So with involuntary treatment, therapy is not at the person's choice. And when it's voluntary, the person chooses to attend therapy to obtain relief from their symptoms. Now, in terms of types of treatment, we can talk about psychotherapy and biomedical therapy. Psychotherapy is a psychological treatment that employs various methods to help someone overcome personal problems or attain personal growth. Biomedical therapy involves medication or medical procedures to treat psychological disorders. And so let's start with psychoanalysis, because it was very popular at the beginning of the 20th century, but it has declined significantly in that popularity and was developed by Sigmund Freud. In psychoanalysis, therapists help their patients look into their past to uncover repressed feelings. And so they use several different techniques to do this. Free association is when the patient relaxes and then says whatever comes to mind. Dream analysis is when the therapist interprets the underlying meaning of dreams. Transference is when a patient transfers all positive or negative emotions associated with someone else to the psychoanalyst. And so, for example, a male therapist may come to be seen as a father figure. Of these, Freud liked dream analysis the most. He called it the royal road to the unconscious. And he said that there was a manifest content, which is what your dream seems to be about, and a latent content, which is what your dream was actually about. Now, play therapy was actually developed by Freud's daughter, Anna, because, believe it or not, children aren't likely to sit on a couch and recall their dreams. And so it uses a therapeutic process of play to help clients prevent or resolve psychosocial difficulties and achieve optimal growth. In behavior therapy, a therapist employs principles of learning to help clients change undesirable behaviors, so rather than digging too deeply into their unconscious. The belief is that dysfunctional behaviors can be changed by learning new constructive behaviors. And so we can talk about counter-conditioning, and that's when a client learns a new response to a stimulus that has been previously elicited an undesirable behavior. And there are two types of counter-conditioning: aversive conditioning and exposure therapy. In aversive conditioning, it uses an unpleasant stimulus to stop an undesirable behavior. So, for example, would be antabuse, and it's given to alcoholics. It's a pill, and it makes you sick if you consume alcohol. And so you vomit and you feel nauseous if you are on the pill and you drink alcohol. If you don't drink, no symptoms. Exposure therapy is when a therapist treats the client's fears or anxiety by presenting them with the object or situation that causes their problem, with the idea that they eventually get used to it. So if you're afraid of spiders, then you're shown spiders. Systematic desensitization is a calm and pleasant state is gradually associated with increasing levels of anxiety-reducing stimuli. The idea that you can't, or this is the idea, is that you can't be nervous and relaxed at the same time. And so if you're afraid of spiders, maybe, and you really like M&Ms, you see a spider across the room, and if you get nervous, you eat M&Ms, and then the spider's brought closer and closer to you every day until you're not upset by it anymore. In virtual reality exposure therapy, simulations help with anxiety. And this is good for things like public speaking or claustrophobia, PTSD, a lot of things. And that's going to be a very rapidly growing field. A token economy is when individuals are reinforced for desirable behaviors with tokens that can be exchanged for items or privileges. So they might get tokens for things like making their bed or brushing their teeth. And then that can later be, those tokens can be exchanged later for more TV time or other snacks or various things. Cognitive therapy is a form of psychotherapy that focuses on how a person's thoughts lead to feelings of distress. So how you think determines how you feel and act. Cognitive behavioral therapy, or CBT, helps clients examine how their thoughts affect their behavior, and it aims to change irrational and negative thoughts. Rational emotive therapy is a type of cognitive behavioral therapy, and it was developed by Albert Ellis, but a lot of the principles are the same. So they examine cognitive distortions, so things like overgeneralizations, when you take small situations and make them huge. So, for example, if your significant other breaks up with you, you start believing that everybody hates you. And that's taking a small situation, one person not wanting to be around you, and making you think nobody wants to be around you. All or nothing thinking is essentially black and white thinking. And so if you ask somebody out for a date, maybe after you've been broken up with, if you get turned down, you think, oh my gosh, I'm going to be all alone forever. And so that's jumping to conclusions too. So you can get your exercise by jumping to conclusions. Humanistic therapy is a type of therapy used to help people become more self-aware and accepting of themselves. And the focus is on the person's present and future to help them achieve their potential. So in humanistic therapy, you don't spend a lot of time talking about your past. Client-centered therapy is a non-directive form of humanistic psychotherapy. And by being non-directive, that means that the therapist doesn't tell you what you should be doing. It was developed by Carl Rogers, and it emphasizes unconditional positive regard, which means that the therapist doesn't judge their client, and self-acceptance. The therapist demonstrates genuineness, empathy, and acceptance of their clients, and this makes people more accepting of themselves. And that's Carl Rogers pictured there to the right. Well, let's evaluate different forms of psychotherapy. According to the American Psychological Association, 3 factors work together to produce successful treatment. Number 1 is the use of evidence-based treatments that are deemed appropriate for your particular issue. Number 2 is that the clinical expertise of the psychologist or therapist. And the third factor is one's own characteristics, values, preferences, and culture. Now, no research has shown one psychotherapeutic approach to be more effective than any other one. One critical factor, though, that determines the success of treatment is the person's relationship with their therapist. What about biomedical therapies? Well, individuals can be prescribed biologically based treatments or psychotropic medications that are used to treat mental disorders in combination with psychotherapy. And this is known as biomedical therapy. Different types and classes of medications are prescribed for different disorders. So, for example, if you have depression, you're given an antidepressant. Bipolar disorder, you're given a mood stabilizer. And in schizophrenia, an antipsychotic drug. Now, that's Zoloft off to the right there, and it's an antidepressant, but it's also used to treat anxiety disorders. It's important to keep in mind, though, that these medications treat the symptoms of a psychological disorder. So they help people feel better so they can function from day to day, but they don't cure the disorder. They treat the symptoms. Another biologically based treatment is electroconvulsive therapy, or ECT. Now, it's formerly known as electroshock therapy, but that's not very scientific. This treatment involves using an electrical current to induce seizures to help alleviate the effects of severe depression. And it's very effective. About 85% of people who receive ECT show improvement. However, there's memory loss associated with repeated administrations of ECT, and it's led to it being implemented only as a last resort. A more recent alternative is transcranial magnetic stimulation, or TMS. This is a procedure approved by the FDA fairly recently, so 2008, and it uses magnetic fields to stimulate nerve cells in the brain to improve depression symptoms. Like ECT, it's only really used when other treatments haven't worked. Well, let's switch gears now and talk about treatment modalities. An intake is when the therapist, or it describes the therapist's first meeting with a client where they gather information to address the client's immediate needs. I guess they also get their address, so maybe that's why it says that. During an intake, the therapist informs the client about confidentiality, fees, and what to expect in treatment. Now, confidentiality means that the therapist cannot disclose confidential communications with any third party unless mandated or permitted by law to do so. Also, during this time, the therapist and client will work together to discuss their treatment goals, and a treatment plan will be formulated. Let's talk about different types of therapy. In individual therapy, and that's also known as individual psychotherapy or individual counseling, the client and the clinician meet one-on-one, usually from 45 minutes to 1 hour, and it can be once a week, it could be once every other week, once a month, it varies. The clinician will work with clients to help them explore their feelings, work through life challenges, identify aspects of themselves and their lives that they wish to change, and set goals to help them work towards those changes. In group therapy, a clinician meets together with several clients with similar problems. One benefit of group therapy is its ability to help decrease a client's shame and isolation about their problem because they're with other people with the exact same problem, and it offers them needed support both from the therapist and other members of the group. However, members of the group may be afraid to speak in front of other people, and there can also be personality clashes among group members. That's why you have the therapist there. So the clinician's there to facilitate the group, and he or she makes sure that everyone benefits and participates, and that no one person is the focus of an entire session. Oh boy, couples therapy. Well, couples therapy involves two people in an intimate relationship who are having difficulties and are trying to resolve them. This is a high conflict situation frequently. The primary therapeutic orientation used in couples therapy counseling is cognitive behavioral therapy. So couples meet with a therapist to discuss conflicts and or aspects of their relationship that they want to change. The therapist helps them see how their individual backgrounds, beliefs, and actions are affecting their relationship. Therapists don't take sides, though. They just try to open up communication. And so they don't say, you're wrong and you need to treat that other person better. What's it like for the therapist? People have described it as it's like piloting a helicopter in a hurricane. So couples therapy is rough going. Family therapy, though, is a special form of group therapy consisting of one or more families. In the systems approach, the family is viewed as an organized system, and each individual within the family is a contributing member who creates and maintains processes within the system that shape behavior. The goal is to enhance the growth of each family member and the family as a whole. In structural family therapy, the therapist examines and discusses the boundaries and structure of the family. So who makes the rules, how decisions are made, and what the boundaries are within the family. And the therapist is there to help with communication, which is what therapists are good at. Let's talk about substance-related and addictive disorders. And addiction's often viewed as a chronic disease because the initial use is usually voluntary, but chronic substance use and abuse can permanently alter the neural structure in the prefrontal cortex. About 40 to 60% of individuals relapse, which means that they return to abusing drugs or alcohol after a period of improvement. The goal of substance-related treatment is to help an addicted person stop their compulsive drug-seeking behaviors. And treatment is much more cost-effective than incarcerating people or giving them no treatment at all. What makes treatment effective? Well, the duration of the treatment is a factor. An addict usually needs at least 3 months to achieve a positive outcome. The treatment needs to be holistic and address multiple needs, not just the drug addiction. Group therapy is the most used treatment modality, and that's because people have all been through this. And so addicts are more likely to maintain sobriety if they're in a group environment with other people who've succeeded. Family involvement in teen drug addiction is vital, and that's correlated with greater reduction in substance use. And treatment also usually involves, or sometimes involves, medications in order to detox, and some of those medications are also addictive. So this is a complex business. Let's talk about comorbid disorders, and that's when an individual has 2 or more diagnoses, often a substance-related diagnosis and another psychiatric diagnosis, such as depression, bipolar disorder, or schizophrenia. Substance abusers are 2 times more likely to have a mood or anxiety disorder, and in cases of comorbidity, the best treatment is thought to address both or multiple disorders simultaneously. Let's talk about the sociocultural model. And this perspective looks at people, their behaviors, and their symptoms in the context of their culture and background. So, for example, therapists need to show cultural competence, and that means understanding and addressing issues of race, culture, and ethnicity. And this is very important as our society becomes increasingly multi-ethnic and multiracial. Multicultural counseling and therapy aims to help clients through modalities and goals consistent with their life experiences and their cultural values. But there still are barriers to treatment. People from ethnic minorities and lower socioeconomic statuses utilize mental health services less frequently. Some of the barriers to service include a lack of insurance, a lack of transportation, and a lack of time. Many reasons why people don't seek treatment are they believe they should be self-sufficient and they don't think they need help. They don't see therapy as effective. They have concerns about confidentiality, or they are afraid of the effects of stigma and shame. Language differences are also a barrier for treatment. Well, that's the end of our book, and so I just want to remind you that all of your APA-style problems can be solved by using my Learn APA-style book and videos. So when you want to learn to write correctly or write right, consult my book and videos on Learn APA Style, which are about writing in psychology and the social sciences. It's been a real pleasure doing this series of lectures for you, and so have a great day, and thanks for listening.